I'm Whitney Dean. You're listening to Talk to the Experts News Talk 770. Many of us, we take our bodies for granted. We don't think about them until something goes wrong. But what if you could predict if you will have a heart attack in the next 5 years? And what if you could do more than just diet and exercise, which we're told to keep our bodies healthy, but, really take care of the most important muscle in our body and even heal it from past cardiac events? There are alternatives to stents and surgeries. There are ways to prevent heart attacks. And we're going to go through some of the myths, facts, treatment options for heart disease. So joining me in studio is Diamond Fernandez. He's the founder and director of the HeartFit Clinic. You can find them at heartfit.ca. That's heartfit.ca. You can also call them 403-870-4348. That's 403-870-4348. And he joins me in studio. Good afternoon, Diamond.
How are you?
I'm good. Okay, so the HeartFit Clinic, what is the HeartFit Clinic?
So the HeartFit Clinic is a cardiac rehab and heart attack and stroke prevention clinic. So we see two different populations. Actually, we'll call them three, really. But one, the first population is those who want to prevent a heart attack or stroke. Mm-hmm. And the latter population is those people who have diagnosed heart disease. Mm-hmm. And there are different types of heart diseases, and we'll get into later in the show. But from a preventative side of things, we do heart assessments that are not covered at your doctor's office. So everything that we do in our clinic is you're not going to find repetition at your doctor's office. So we determine where your risk is of a heart attack or stroke, based on our screening tests and what we have available. And from the treatment side of things, again, we do stuff that you're going to not find at your doctor's office, but we focus on really three focuses, 3 E's, I call them. So external counterpulsation is one of them. Mm-hmm. Exercise and then education. And education comes in the form of focusing on heart nutrition, focusing on supplements, making sure those are taken all, and stress management. So that focus on education from that perspective.
Mm-hmm. Yeah. Okay, and you do mention your family doctor, and a lot of people think of that. They think, if I have a genetic predisposition, people who know that their family members have had heart disease, they think, well, my family doctor knows that I'm at risk. I'm sure they're doing the testing that needs to be done. Or people are thinking, maybe I've had some heart issues or something irregular. I'm just feeling that like I'm getting a bit older. They think, I go in for my yearly physical. What's the difference?
Yeah. And so, doctors do their best in what is in their toolbox. And unfortunately, what's in their toolbox is not the best in terms of determining where your risk is of a heart attack or stroke. So let's talk about that toolbox that the family doctor has and how we differ than going to your family doctor. So when you go to your family doctor, specifically for looking at what your risk is of a heart attack or stroke, they'll put you in what we call the Framingham Heart Score. So that's something that listeners can Google online. So Framingham Heart Score, for those who don't have time to Google, I'm going to quickly tell you, it's just focusing on some risk factors to heart disease. Mm-hmm. And the big ones that what goes into that score is basically, I'm going to try and remember them all, but anyway, it's age, gender, previous family history, if you have diabetes, if you have high blood pressure, or cholesterol, right? And so we plug all these numbers into the formula and we determine where your risk is of a heart attack or stroke in the next 10 years. Mm-hmm. And in spite of that, you'll fall into 3 different categories. You'll fall into either a low risk, a moderate risk, or a high risk. And a very small percent of the population falls into a really high risk category. Mm-hmm. But there's a lot of people in the borderline and a lot of people in the low risk. And so when you go to the hospital and you determine that, this study was done with about 178,000 people. So what they did and they found is that based on the Framingham Heart Score and where you place people, the majority of people that are in the hospital with heart attacks and strokes have normal to maybe borderline profiles in the Framingham Heart Score. So I think we're doing a really not so great job in determining where your risk is of a heart attack or stroke on the family doctor level.
Yeah, I think for a lot of people, they think if I'm leading a healthy lifestyle, my family doctor gives that clean bill of health, it should be fine. Or that there's even other tests that, maybe if I push my family doctor to send me to a cardiologist, well, they can do the testing and it will be fine there.
Absolutely. And so let's say you do come out at risk. Let's say you have high blood pressure or high cholesterol. Let's talk about, I'll get into cholesterol a little bit more in detail. I could talk the whole show about that if you wanted to. And my point is that let's say you have high blood pressure, diabetes, or, so did I say all those 3 things? So high cholesterol, diabetes, or high blood pressure. So any one of those, we'll call them the top 3, right? Or even family history for that matter. they might send you to a cardiologist, right? And the cardiologist will do some investigations to see where your risk is of a heart attack stroke. So they'll send you to the best cardiologist in the city, and they'll do 2 tests. One is an echocardiogram, which is an ultrasound of the heart. And that's important because it looks at structure and function of the heart, and it looks for other types of heart diseases, right? But when we talk about coronary artery disease, when we talk about our plumbing, even though your arteries are not a pipe, they're a muscle. When you talk about coronary artery disease, the non-invasive test that we've been doing forever is the stress test, which is the exercise stress test. And a lot of listeners know about that. The problem with the exercise stress test is
that's the image of the people on the treadmill and they're running and then they're timing you and monitoring your heart.
Exactly. And they look at your heart rhythm to see what's going on. Now, we're looking to see, I'm going to get a little scientific with you, but they look to see if you're ischemic, which means a lack of oxygen going to your heart muscle. And we can look at that on the ECG. The problem is that it'll only show advanced stages of a disease, right? So you got to have a blockage that is about 80% or more blocked before it starts to show up on a stress test. So I don't like the outcomes of either of those options. So let's say they do find something. You're going to go on for further testing, right? Which I don't prefer. Or number 2, which is even worse, that you're going to be given a clean bill of health. Your arteries are not 80% blocked. So don't worry, keep doing what you're doing. And, you don't have coronary artery disease. Here's something that's very important to understand. And I'll go back to cholesterol in a second. But the majority of heart attacks and strokes actually occur with blockages that are less than 50%.
And that's really important to know. Even if you've had a heart event, they'll tell you all the rest of your blockages around your heart. And a lot of times you'll see 40%. Well, that one's just fine. Don't have to worry about that one.
Yeah. And so I'm going to explain something about that as well, is that think about those blockages like a pimple on your face, right? Firstly, how does that pimple get on your face? It happens internally, not externally. So I'm going to get our listeners to just make a circle with their thumb and their index finger. And that's what the inside of your artery looks like. It's all skin, right? It's a muscle. It's not a pipe. And if it was a pipe, it would be easy just to go, all plumbers would become cardiologists.
Yeah.
Right? It would be that
plow
simple.
through, it's fine, and it'll be fine afterwards.
The point is that, cardiologists go through a lot of education to do what they do, but the arteries are not a pipe. They're a muscle. And so if we think about it from that perspective, imagine that pimple growing on the inside of your skin. That's how it happens. And here's another key factor to understand is that the majority of heart attacks and strokes actually occur with people with normal cholesterol. So when you look in the hospital, the majority of those people that have heart attacks and strokes have normal cholesterol profiles, stuff that would not get treated. So it's not about cholesterol. And I can get into that part a little bit later.
Oh, yeah. We are definitely going to get into that a little later because there's been some headlines around it and everything. So I want to get your take on it as well. So I want to also get into some of the treatments, some of the testing a little bit more as well. And also, and let's go into this a little bit more though. You're not anti-doctor per se. They have a place in the system.
Absolutely.
But their place is different than what maybe we think of in terms of when it comes to a heart attack or heart disease.
So the HeartFit Clinic has the most accurate screening test to detect what your risk is of a heart attack or stroke in the next 5 years. Instead of putting your numbers into a Framingham heart score, which we talked about looking at cholesterol and blood pressure and age and diabetes, instead of doing that, we have the most accurate screening test to see where your risk is of a heart attack or stroke in the next 5 years. That's what we focus on. So instead of going to your doctor to see what your risk is of a heart attack or stroke, or even seeing a cardiologist, these people are important. Don't get me wrong. But the point is that if you want to know what your risk is of a heart attack or stroke, that's where we come into play. We focus on patients who want to know what their risk is. If they got that query chest pain or something like that, a lot of times they'll go down that path and get a clean bill of health. And there are different types of heart diseases that we focus on as a clinic. And, whether it be atrial fibrillation or valvular disease or heart failure, those are all different types of focuses, or congenital diseases or valvular. There's all these different aspects that we focus on to help people cope or prevent or reverse that disease process. And the HeartFit Clinic really focuses on heart assessments to let that individual, that prevention person who might be just wants to know, or a little bit higher risk with those blood pressure, cholesterol or whatnot, to see where the risk is of a heart attack or stroke.
We're going to find more about some of those assessments, also some of the treatments as well. Talking to Diamond Fernandez, founder and director of the HeartFit Clinic. Heartfit.ca is the website, heartfit.ca. You can also call them toll-free, 1-877-700-4348. That's 1-877-700-4348. You're listening to HeartFit on Talk to the Experts on News Talk 770. Listening to Talk to the Experts with HeartFit on News Talk 770. Diamond Fernandez is here, founder and director of the HeartFit Clinic. Heartfit.ca is the website, heartfit.ca. You can also call them 403-870-4348. That's 403-870-4348. Okay, so Diamond, earlier we were talking about treatment and assessment a little bit when it comes to heart disease, more about assessment and prevention and what your clinic does. But there have been a lot of headlines. When people think of heart disease and heart attacks, it's cholesterol. It's all cholesterol's fault. And so there have been some headlines around this, and you brought in a little bit of a showpiece for us today, which is an injectable, I believe it's an injectable drug. And the headlines is that it cuts down your LDL cholesterol by 74%, which to me, reading that, I think, wow, we've solved heart disease. We've solved cholesterol, because we always associate cholesterol as the culprit to heart disease. But I know you have a very different take on this and have a lot of knowledge when it comes to cholesterol.
Yeah. So for those people who have cardiovascular disease, or for those people who have high cholesterol, this is very important for you. Yeah. So if you're taking a cholesterol-lowering pill or an injectable, or you have heart disease, or whatever might be the situation, I'm going to talk about cholesterol really strong here.
Yeah.
And the HeartFit Clinic really focuses on treatment options. We talked about those 3 E's, which is exercise, education, and external counterpulsation. And education focusing on a lot of, the proper nutrition, the best supplements to be taking, and really stress management, which I think is a big key factor here. Another thing I want to start off by saying is that, and I'm going to say it a lot today, is that your arteries are really a muscle, not a pipe. So let's just imagine that for a second here. You have cholesterol. We have good, bad, and ugly cholesterol, right? We got this bad cholesterol floating around our bloodstream, and it just accumulates to the sides of the arterial wall until it gets to about 90%. And then if it just goes that extra 10%, we end up with a heart attack. That's furthest from the truth.
It's like just blown out everything that everyone knows about heart attacks.
The fact is that the majority of heart attacks happen a lot less than that. I talked about in the other part. And the HeartFit Clinic focuses on assessments to see where your risk is of a heart attack or stroke in the next 5 years.
Yeah.
So just previously, I talked about how we differ than going to your doctor, whether they're important to understand those some key risk factors, and then how we differ from a cardiologist, from a preventative side of things. If you're having a heart attack, I think Calgary has some of the best places in the world in treating heart disease. We got the best cardiologists in the world in an emergency situation. But from a preventative levels, I think I don't give us a great grade from that perspective. And so when we look at that from that perspective, and what you just shared with our listeners is that you can reduce your your bad cholesterol by 74%. That's really big. But when you look at the key numbers, and what I'm talking about when I say key numbers is the primary endpoints that we look in a trial. So now we've lowered, so let's just take it for simple math for people. Everyone's heard of LDL cholesterol, which is the bad cholesterol or the loser cholesterol. Firstly, they come in different shapes and sizes. There are large ones and small ones. These are tests that we can do in our clinic as well. So we look at what we call particle size. Imagine the arteries protected by a tennis net. You have the tennis balls that can go through, that cannot go through a tennis net, and you have the golf balls that can. So it's the small particles that are what we call, I'm going to use a big word today, atherogenic, which are the particles that can cause atherosclerosis. Atherosclerosis is the buildup of plaque in our arteries, okay? But arteries are a muscle, not a pipe. And it doesn't accumulate to the wall of the arteries. It happens like a pimple on our skin. So it has to get what we call oxidized or broken down. So those small particles have to break what we call a small little layer. It's called the subendothelium. So if people want to Google what I'm talking about. So the subendothelium has a whole biochemistry process of oxidizing, or what we call breaking down that cholesterol to put what we call end as being a foam cell and then builds the plaque from the inside out. So imagine that pimple on our face, it gets bigger and bigger and bigger. And then eventually it could then pop, right? And if it pops, that's a heart attack or stroke.
Yes.
Okay,
that makes sense.
So let's just go back to the lowering. If we can lower our cholesterol by 74%, we should see better outcomes in terms of reducing your risk of then a heart attack or a stroke.
I feel like if you read that headline and didn't do your research, you'd be like, oh, I guess it reduces my risk of heart attack by 74%.
So I'm going to go through the primary endpoints. So the primary endpoints are cardiovascular death, which is a heart attack or stroke, a heart attack, okay, hospitalization from heart pains, okay, or revascularization, which is a heart stent or bypass surgery. And we'll talk about heart stents and bypasses here in a little bit. So the HeartFit Clinic focuses a little bit more on educating people to understand, okay, well, while it might be important to take your medications, it's important to understand what we call a number needed to treat, or understanding the risk of lowering your risk of a heart attack or stroke. So while we lower your LDL cholesterol or your bad cholesterol by 74%, you're only reducing your risk of a heart attack or stroke, what I just went, those primary endpoints there, by 1.5%.
That's nothing for what you're taking and putting in more drugs into your system. I just feel like that's not...
While it could be important for a certain population of people, 1.5%. That means I'm going to make 1.5% a number that people understand. That means that 75 people need to walk into a doctor's office prescribing this medication for one person to benefit.
That's really disappointing.
So I can get better odds going to the roulette table. Or, whatever my point is that it's not the best odds when we're talking about playing with your heart. When we're talking about your heart health, there's a lot more that you can do. And to understand that if you're not going to do anything, yes, medications are very important, but they're not designed to reverse or prevent or that heart attack or stroke as much as we think it is. And that's,
Do you guys get your patients actively involved then in their process and how it works when they come in?
Yeah, absolutely. And so, look, medications are very important early on in the disease process. And what I think has to happen is if someone's cholesterol is high, why? Right? Find out why. There's so many different reasons. Cholesterol is important. If we take something and we lower cholesterol and we take it completely out of the equation, you require cholesterol in hormones and sex hormones and energy, and it's required in a lot of different cells in our body. And so if we take it out of our body unnaturally, you're compromising something else on the other end. And so the big question is that why? Why do you have heart disease? Why is this cholesterol accumulated in your blood? And so the key thing to really focus on is how can I lower the inflammatory response? Remember how I talked about that subendothelium? How can we lower the inflammation or the oxidize or the breakdown of that cholesterol? What can we do to lower that? And that's where I think whoever can make a drug to really focus on that and really reverse that process, that will be the best drug available.
But in the meantime, you're able to assess that beforehand and look at that and really look at those reasons and talk to them about it.
So what we focus on the HeartFit Clinic is those 3 E's: external counterpulsation, exercise, and education. And education, like I said, comes in the form of nutrition and stress management and supplements and understanding what you should and should not be having. And understanding that everybody is different. And so you might be at risk of a heart attack or stroke for a different reason than someone else might be. And so it's important to understand that. And we treat people individually. So when we determine what your risk is of a heart attack or stroke in the next 5 years, we can reverse that process.
Which sounds to me very different than when we were talking about how people go into their family doctors and you plug in a few numbers and then you figure out whether you're low, moderate, or high risk. That seems like your approach seems very different because there's a lot more questions than just a few numbers. Yeah,
and that's the big key factor there is, okay, well, if I want to know where my risk is of a heart attack or stroke, that's where the HeartFit Clinic comes into play. We specialize. That's our focus. That's what we do, right? And how we differ than going to your doctor, let's say you even got to the gold standard of looking inside your arteries, which is an angiogram. Okay, so for those listeners that don't know what an angiogram is, it's where they insert a catheter through your arm, they eventually get to your heart, and they can flush the heart with dye, and they can see where the blockages are. They can tell you if you have 100% blockage to 20% blockage. I just finished telling you that the majority of heart attacks and strokes occur with blockages that are less than 50%. Not to dismiss those blockages that are at risk, but If you are coming from an emergency side of things and they're doing that angiogram, absolutely, that's important. But if you're not coming from an emergency side of things, I don't necessarily agree that's the best path. And that's where external counterpulsation, exercise, and focusing on nutrition through education that we talk about, you're going to get much better focus on that part. So a lot of listeners, I don't necessarily want you to take my word for it. If you're listening for the first time and there's no trust involved, Google it. Understand that there's some things that you can learn to understand. I can help people navigate that part of it. I mean, that's where a clinic does. If you have heart disease, we can understand where your risk is of a heart attack or stroke, number one. And number two, that if you do have at risk, let's say you have a stress test that fails. Let's say you fail a stress test and you fail the next test and you go into an angiogram. I don't necessarily agree that's the best path for that patient.
You're also one of the few places that offers it, but you're in with a lot of, I guess, big names of places who use it, like Cleveland Clinic and Mayo Clinic.
Absolutely.
But you're one of the few who even offers this in Western Canada.
We're the only ones in Calgary that offer it.
Yeah.
I think we're one of two clinics in all of in all of Western Canada. I know Edmonton's looking at getting one, but
which means you don't have to travel for it. And I know that you've traveled looking for all this information as well.
Oh yeah, I mean before we got that treatment, I made a lot of travels down to the States to check it out. I went out east to check a lot of things out, and I mean, until you get the machine, you're always skeptical until you see the benefits that come from the patients going on the treatment course of us. I mean, that's what I love. That's what I love to see is the changes in patients.
So I know you've mentioned external counterpulsation a few times. We're going to talk a little bit more about that. Also wanting to talk about stents as well, because for many people, if they've had some type of heart event, they think, you know what, I have a stent and it should be solved. So we'll talk a little bit more about stents, how they work, and then also things you can do afterwards, after you've had a stent, and what the clinic can offer you. Diamond Fernandez, founder and director of the HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. Also their phone number 403-870-4348. That's 403-870-4348. Back in a moment with HeartFit on Talk to the Experts, News Talk 770. Talk to the Experts, News Talk 770, here with HeartFit Diamond Fernandez, founder and director of the HeartFit Clinic. Heartfit.ca, heartfit.ca is the website, or 403-870-4348. That's 403-870-4348. Okay, so Diamond, you mentioned this a couple times as we've been talking about heart attacks, heart events, cardiovascular health, is external counterpulsation. So what is this treatment? What is an ECCP is what you call it? ECP?
External counterpulsation.
There
Yeah,
you go.
ECP. And so what it is for patients that do have or are at like really high risk of heart disease, for those patients who have a stent or bypass or looking at going to one. So let me just brush on that part of it. For those patients who saw their family doctor or went to the hospital even, and they were having chest pains, and they went back to their family doctor and said, okay, we'll get a stress test and see what's going on.
Yeah.
Right. That's the test where it can only show advanced stages of a disease. And then the next step is to do what we call a perfusion scan, which is a nuclear stress test. And with that test, I think you should only go to that test, and there's certain criteria that you should go to. I can talk to you about a little offline as to reasons why you should go to that test. But if you do that test and they find that you're at risk there, then you find yourself in the hands of an interventional cardiologist. Now, they're really good at what they do. I mean, they focus on the heart, right? And so what they do is they go in with a catheter and they see what's going on inside the arteries of your heart, and that's an angiogram. And I don't think that test should be done. There's a small percentage of people that should have that test done coming from that umbrella. Does that make sense? And so saw your GP, saw a cardiologist, now you're in the hands of an interventional cardiologist.
Yeah.
There's a small percentage of people. I think we send maybe too many people down that path. Now, instead of doing that path, external counterpulsation is a much better treatment option to help with that heart aspect of it. So let's just talk about the artery for a second. You have a blockage. Let's say it's significant. It's 80% or 70% or whatever it might be. And it's enough to give you a little bit of chest pains or discomforts once in a while. What happens is that is like a pimple on your face, right? Like imagine that pimple on your face and it's grown a little bit and everyone's had that pimple before. I think I have one right now. I have right now on my forehead. So it's all good. A good thing I'm on the radio today, not on TV. So what happens is that I forgot what I was saying now.
But it's just that, so
You
it
know,
starts to grow,
It
and
starts,
then
yeah. And so what happens is if it happens inside the artery, right, and that pimple starts to grow, that can cause some decreased blood flow through that area. And so if we go in there with a heart stent, we can actually do more harm than good to the artery. Does that make sense? And
Yeah.
so the catheter is going in, and now you're going in not with a heart attack. You don't have an emergency situation to go in, and we're going in from a preventative level. We can do more harm and good to that artery. And so while it's a nice thinking that your arteries are like a pipe, they're not even close.
yeah.
Right? If it was a pipe, we could just go in there and flush it with Drano and do
Be done with
what we'll
it.
call a little atherectomy, which is scraping the pipe so it's completely better blood flow. It doesn't work that way. And so we can actually do more harm than good to the artery that way. And so, I mean, you can Google this. How long do heart stents last? And you'll see that there is a failure rate on them. And you know, if you have even from a heart attack, you know, if you've had a heart attack, the biggest year, the first year of a heart attack, or the first year of placing that heart stent, whether you've had a heart attack or not, is the most dangerous, right? And we have a big, strong failure rate. And then it closes down from that. And then it escalates again at around the 5 to 7 year mark. So the artery can then start to close up and cause problems again. So it depends. I mean, everyone's anatomy to that heart stent is always different, but understand that it's a foreign object going inside your arterial wall. So external counterpulsation is a better treatment option for patients coming from that stable pain or investigation from that perspective. External counterpulsation, how it works is that you have these cuffs that go on your calves, your thighs, and your buttocks. And now it sequentially inflates and it pumps blood back up to the heart. And what it does is three things. It actually helps grow new arteries. So it's a process of angiogenesis. So it grows new arteries. Number two, it improves artery function. So let's talk about that pimple on your face again. What it does is it strengthens the skin over that pimple, so it never becomes a pimple that pops. Right?
Because it sounds like it's like a workout for those muscles.
Yeah, and your artery is a muscle, right? We
Yeah.
talk about that a lot today, and I'll continue to. But the point is that to understand that your arteries are that focus, and so we can strengthen that skin over that pimple to make sure it doesn't cause any concerns. Right? Obviously, focusing on what we do. And the last thing is it also improves heart function. So who is it for? Basically, it's for patients who have coronary artery disease. It's for those patients who have heart failure or at risk of, right? And so when you can improve, I mean, this is what I love about our treatments. We can improve heart function like a ridiculous amount of percentage. We've had patients that instead of going for bypass surgery or going for a heart stent electively like that. And they're sitting in the hospital waiting to get the stuff done. And they tried, okay, well, I can always get my chest cut open another time.
Yeah.
But let me try this non-invasive option first. And if it doesn't work, I can always get my, my chest cut open another day.
Yeah.
But that's the thing is that if we can get the results that improve someone to the point where they don't require surgery, or we can postpone surgery or whatever it might be. So there are a lot of people out there that have had a heart stent that are now starting to feel some chest pain. And when you do have heart disease or coronary artery disease, you're always, every little tickle in your, you're worried about it, right? You're always like, okay, well.
You're hyper aware when something happens
You're super
or something
hyper aware.
different.
And that's what we focus on in the HeartFit Clinic. We can determine where your risk is of a heart attack or stroke and then provide you that preventative options, right? To reverse that process. And so we've seen people minimize angina, minimize chest pains, increase heart function, increase artery function. And we've got a lot of data to show this. And there's a lot of research out there. This is not something that we just went out and started to say, okay, this is a new thing.
Yeah.
I mean, before having it in Calgary, you had to, fly down to the Mayo Clinic to get all these things done or down in the States somewhere, right? Now you don't have to. We have it all here in Calgary, in a great city of Calgary.
Do you find that you are busting myths a lot of times when people come in and then they talk to you about how they understand heart disease or cardiac disease and what they've been told? Do you find that you really have to explain this to people?
Yeah, and it's, I think, like I said, I think when you go to your family doctor, they're limited to what's in their toolbox.
Yeah.
So what is in their toolbox? They just have, medications in their arsenal, right? That's it. And so, okay, well, we know the numbers needed to treat or the absolute risk reduction and lowering your risk of a heart attack or stroke. We talked about that earlier. So the HeartFit Clinic focuses on tests to see where your risk is of a heart attack or stroke. If you go to a cardiologist and you open up their toolbox to see what they can do to help you with heart disease. They got some diagnostic testing, which you can do, which is important. Don't get me wrong. But there's the treatment side of things, which is more important. And heart stents, and what they have in their toolbox is heart stents, bypasses when it comes to coronary artery disease, and medical therapy. And so there's a lot of things that you can Google out there, heart stents versus medical therapy, even for that matter. And it's something called the COURAGE trial. And we know that, if we give someone a heart stent and we give someone medical therapy, we almost get the same outcomes.
Wow.
So why are we even doing a heart stent? There's studies out there comparing exercise to heart stents. On a preventative level, that should never happen. Yeah.
And it is an approved test. Like, it's FDA approved.
Yeah, absolutely. Yeah. And so...
Because I think for some people, they think, well, maybe I haven't heard about this. Is this experimental? But it is used elsewhere.
Yeah, it's we're not the first clinic to have it. There's thousands of clinics.
Yeah. It just doesn't seem to be so far very common in Canada. I remember you've talked before, like in Europe and in Dubai, and then in the U.S. as well.
Yeah, all over the place. It's an amazing treatment. It's a good first line for patients to do. And if you have heart disease or coronary artery disease, it's an amazing treatment to do because heart disease is a progressive disease. Our focus at the clinic is to halt it or reverse it.
And that's an interesting part too, is I think for many people, once you're told that you have something wrong or something has happened to you, that that's it. There's no turning back, and now maybe you can just manage it a little bit, and that's that. But this gives you a way to, as you said, reverse it possibly.
Yeah. If you've had a heart event, whatever the situation is, and you have a heart stent or bypass, this is important to understand. The HeartFit Clinic focuses on reversing or halting that disease process. Your cardiologist, all they have in their toolbox is another heart stent or bypass or medical therapy. And they want you to at least be on medical therapy to make sure that you can at least minimize your risk of a heart attack or stroke. But when you talk about numbers needed to treat there, it's important to say, well, why did you have that heart attack? Like, that's what we focus on the clinic. The HeartFit Clinic focuses on things that we want to know why.
Yeah.
And everyone's different.
Yeah, no, definitely.
Yeah.
Talking to Diamond Fernandez, founder and director of the HeartFit Clinic. And Diamond, you also have a seminar coming up as well.
Yeah, it's going to be on the 27th of September, the day before my birthday. So, not that I want a bunch of calls for my birthday, but the point is it just happens to be that way. And I'm going to be talking about some 5 powerful things that you must know about heart disease. Yeah.
And are some of those things included in your book as well?
Yeah, absolutely. And I'm not going to be talking too much about my book. It's just undergoing the last few editing stages there. But I'll have a separate event for that book launch there.
Oh, nice to listen. Okay, we'll have to listen for that. And we'll have more from Diamond Fernandez, founder and director of the HeartFit Clinic, in just a moment. Heartfit.ca is the website, heartfit.ca. You can also call them 403-870-4348. That's 403-870-4348. More with HeartFit on Talk to the Experts in a moment on News Talk 770. We have been learning a lot about our hearts, about cholesterol, about stents, about treatment options for heart disease, and also about assessments as well. I want to go through some of them with Diamond Fernandez. He is the founder and director of the HeartFit Clinic, heartfit.ca. That's heartfit.ca is the website. You can also call them 403-870-4348 or toll free 1-877-700-4348. Okay. One thing, Diamond, that we want to stress with people is that if you are worried about something that could potentially happen with your heart, it doesn't hurt to give you guys a call at least.
Yeah, absolutely. And so what we can do at our clinic is you can talk to our lovely team there, and we can determine what the best course of action might be for you. And it's worth the conversation. You only have one heart. So, you got to make sure you love it and take care of it.
And especially, I think that test, and it's the test where you can figure out whether you're at risk of a heart attack in the next 5 years. To me, that just sounds so revolutionary.
Yeah, it's a test that we actually take down to the States and get that analyzed, and some beautiful data comes back to us to see where your risk is of a heart attack or stroke. And more importantly, people always ask me, okay, well, I don't really want to know how to do that. I don't really.
It scares me.
Yeah, it scares me.
It scares me that something scary could come back, and then what do I do?
Yeah, ignorance is not bliss. And the fact is that if you know you're on the path of a heart attack or stroke, we can stop it.
And that's through external counter pulsation. I think I finally have that right after a few shows now.
So we focus on some treatment options. And of course, lifestyle education is a very big thing of what we do in our clinic. We talk about nutrition more than just the Canada Food Guide, because I think we got to improve that a bit. And when you look at supplements and understanding your medications that you're taking, and that's so important for patients. And so if you have high blood pressure or diabetes or cholesterol, it's important. You gotta you gotta be able to have a conversation with us to see, okay, well, where is my risk, and more importantly, what can I do about it?
Yeah.
Because I think pills are very important. They have their place. I think it's important, especially early on in a disease process, but taking them for many, many years, even decades for some people, it can have some repercussions on that. It's stuff that we just don't know. We don't know what happens to patients when they take medications for long periods of time. And especially the cholesterol-lowering medications. We talked a little bit about that part of it. And the majority of heart attacks and strokes actually occur with blockages that are less than 50%. So that's why even if you had the best, doctor giving you an angiogram just on a preventative basis, it's important to understand that those blockages can be quite dangerous. And so what is your risk of a heart attack or stroke? And that's what we have available at the HeartFit Clinic. And understanding that the majority of people who end up in the hospital actually have normal cholesterol profiles.
And to me, that's what we're always told, is that there's good cholesterol, bad cholesterol. You have too much bad cholesterol. Yeah. Oh, if you just lower it, I think there's this sense that, you'll be just fine.
Yeah, it can float around your bloodstream all day long as far as I care. But it's really what we want to minimize. And that's the important part, is that how can we minimize damage or inflammation to the arterial wall, right? And so it's about minimizing that part of it. And we got now enough literature out there to say, okay, well, I think we might have cholesterol. We should maybe put that on the side and really focus on something else here, because how can we minimize this oxidative process, which is the breaking down of that cholesterol? Like I said, it can float around your bloodstream all day long. Once it gets broken down, that's where it's dangerous to us.
And I think for a lot of anyone who's been through a heart event or a heart attack, there is this sense that, just go on your medications, live a healthy lifestyle. Something might happen and something might not. We don't know. Yeah. Where you guys are able to provide some of those answers and some solutions.
Yeah, and we have so many different options that we can help you out with, right? From, providing you the education, which is key, and understanding, why did I have that heart attack? I'm whatever. We have people that are in their 30s that have heart attacks, right, to people in their 90s, right? And so that's 6 decades of people that we got to figure out, okay, well, why did this person have a heart attack? Everyone's different. We just can't lump some people and just say, okay, you're going to be on the same cocktail as a 50-year-old, someone 2 decades older than you. There's some questions that you have to ask. Ask yourself, ask your healthcare team to see, okay, well, what is more that I can do? And we are more than what you can do. Yeah. When it comes to heart disease, that's our focus. That's all we do, and so we're really good at what we do. And that's especially when we just narrow in on that part of it.
And I know you're really good at it too, because when you come in here, you've a lot of times been to conferences, or you've found new things, like the pulse test is one of the new things you found recently, external counter pulsation as well. Like, you are on cutting edge and always looking for the newest thing when it comes to heart disease, and then looking at the studies. You always have the research and the studies when you come in as well.
Yeah, and I shared a little bit with you guys today, but the focus is really to understand. I mean, one of our big core values in our clinic is innovation, and really want to be the cutting place to understand, okay, well, what more can we do?
Yeah.
And I'm just that type of person. If I see someone with a problem, I'm like, okay, what more can you do? Right. And going to your family doctor, yes, look at their toolbox, see what advantage you can take from there. Right. And if they can't take advantage there in their toolbox, like we said already, that a family doctor to see where your risk is of a heart attack or stroke, it's limited, right? It's limited to what we call the Framingham Heart Score, right? And so that's where the heart test that we do to see where your risk is of a heart attack or stroke in the next 5 years is so much more powerful.
Yeah.
So much more powerful than that part of it. And then even if you go see your cardiologist, right, from a preventative level, they're only looking to see if you're a high risk. And if you're not high risk, unfortunately, you just might get dismissed that part of it. And that's where we focus on. Well, what's going on here? What's your risk? What's truly your risk, to see that part of it. And
you're giving a talk on this coming up later in September.
Yeah, so September 27th is going to be a free talk. If you can remember the website, it's heartfit.ca/events. And that's where events, either one will take you to the same spot. And if you can register online, that's a free ticket for you. I know we only have I think we already have about 150 people registered for it. So,
wow. Yeah. Because people are really interested in it. They want to know.
It's super valuable information. And we got some excellent stuff that I'm going to share with people. So
Perfect.
Yeah.
So that is with Diamond Fernandez. He's the founder and director of the HeartFit Clinic. And thanks for joining us today.
My pleasure.
Diamond Fernandez, HeartFit Clinic is heartfit.ca is the website, heartfit.ca. You can call them 1-877-700-4348. Also locally, 403-870-4348. That's 403-870-4348. I'm Whitney Dean. You've been listening to HeartFit on Talk to the Experts on News Talk 770.